Hello, this is Dr. David Green, Education Director for Pacific Bay Recovery in San Diego. Today's topic is private drug rehab for pilots. Let's look at the scope of the problem first. Over 10,000 people in the U.S. abuse prescription medications for the first time every day. Drug abuse truly knows no socioeconomic boundaries, with both blue and white-collar individuals being susceptible. 11% of all aviation accidents involve a pilot who tests positive for a substance. The average age of pilots who abuse substances is older than the typical general population drug abuser. Pilots abuse the same drugs in the same amounts as the general population. Reasons that pilots abuse drugs may include stress with long hours in the air, lack of sleep, time away from home, memories of past accidents or friends' accidents, and the usual family stresses or finance issues. It's not your typical spiral. In initial stages, a pilot with drug abuse relieves anxiety and fear. The pilot can make enough money to keep up with the addiction. Most feel like, I can handle this, I can beat it myself. When the idea of rehab comes up in their head, initially it involves a combination of shame, fear, and denial. In reality, pilots are no better equipped to overcome addiction than the rest of the population, and there's a lot at stake with hundreds of passengers. The dependence eventually turns into a chemical imbalance, which needs professional help to overcome. Once that's realized, it helps to objectify the problem and make pilots feel less ashamed. Pilots who find themselves mired in addiction can seek confidential treatment. In addition to HIPAA, which is Health Insurance Portability and Accountability Act for confidentiality, records for patients undergoing treatment for substance abuse are protected under Title 42 in the Code of Federal Regulations. So if a pilot does go to seek treatment voluntarily, there's no mandate for the center to report that to a licensing board. Pacific Bay Recovery is both private and comprehensive. The steps involved include an extensive intake process along with a medical detox, and then inpatient rehab, which may be 30 to 90 days, and outpatient recovery for long-term success. Our private rehab center offers both inpatient and outpatient treatments for the highest success rates, which are over double the national average. The average for a professional such as a pilot exceeds 90% long-term success. You can remain anonymous, and the center can take care of all the arrangements. Call us today at 858-263-9700, and then visit us online at pacificbayrecovery.com.